I think two of the outstanding highlights from this year's conference was the research session that was run by Jackie Stringer, and they looked at isolation practices over the past 60 years, and they had three presenters talking about past, present and future, and looking very far into the future and how maybe we can do transplantation in a different way with regards to isolation practices. Because it's very tough for patients to come into a room and literally be in that room for up to 6 weeks, sometimes even longer than that, and to them it feels very much like a prison cell that they're kept within, and somebody comes in and feeds them and gives them drugs and leaves, and they can't go anywhere. Even if you're in prison, you're allowed 1 hour a day when you leave the room. In transplant, you stay in the room and you really don't leave it, and that's really hard. That was a fantastic presentations. The other one that was also really good was fertility, and we had three presenters again, and they were talking about preservation of fertility pre-transplant and the difficulties of conception post-transplant. It's often very difficult for patients to become pregnant after their transplant. They are rendered infertile by a lot of the chemotherapies and radiotherapies that they receive, and they require assisted conception, so often donor eggs from relations or completely unrelated people for them to be able to become pregnant. Men are able to obviously store sperm before they're rendered infertile, so this can be taken from the freezer and used. But again, this fertility session was excellent, and I'm told that one of the clinicians in there commented afterwards that even I learnt something, which is always good to know that one of our doctors has learnt something from a nursing session. That makes me very proud.